Hi everyone. Today I'm excited to welcome Torrie, a clinical and medical affair strategist who has spent her career driving digital innovation, health equity, and patient-centered care. With deep experience in cardiology, medtech, and early stage startups, Tori brings a unique lens on how emerging technologies can reshape the patient journeys and, like, at the same time, transform how the care is delivered. Tori, if you want to add anything in your introduction.
No, you did a great job. Thank you for having me. I'm excited to talk about some of these topics and dig in here a little bit.
Sure. So with that, let's start with the first question. So I wanted to ask that how do health equity challenges play into these inconsistencies, especially across diverse population?
Yeah, that is a great question, and I'm glad we're starting off with this. So, consistent care does start with equitable care and designs, and that goes deep into even algorithm bias and using diverse data sets to create those algorithms. Um, when we have when we lack that diverse data set, it does create barriers and inequities from that very point. So I also want to say a little bit about tech access and health access, and they are very different. Where health access is obviously the ability to go and see a physician, and that might have something to do with, you know, transportation, insurance, proximity, but tech access also has to do with broadband access or internet and the cost, as well as the health literacy of those individuals that still create those divides. So equity must be built from ideation and not added in later or, trying to fix it after the fact.
Sure. Talking about barriers, what operational or systemic barriers have you seen that make it, hard to deliver a consistent experience, patient experience across multiple touch points?
Yeah, that's important. I think fragmented health systems are definitely a number one barrier. So we have these fragmented health systems or these fragmented systems of care where EHR is siloed and those EHR systems don't necessarily talk to one another. So while EHR is supposed to solve for this transfer of care and this transfer of your records, it doesn't always work that way. And clinicians are overloaded. And so when that fracture exists, um, we're expecting clinicians to fax over notes, and that doesn't always happen. Um, there are access challenges. So, with regards to just setting up that telehealth infrastructure, um, and then there is the prevention gap. So we patients, the majority of patients enter the healthcare system when they're in crisis. They
Mm.
enter when they are sick. They enter the ED, or they might come in with a stroke. They're not coming in for wellness. They're not coming in for prevention. And so that creates a lot of operational challenges where, we're trying to get someone into a specialist who has primary or is doing preventative care, but that wait list is so long because they're also managing patients who come into the system incredibly sick, and unfortunately those patients do get triaged more quickly because they are sicker. So if patients aren't entering the health system earlier, and if we as a health system aren't incentivizing care and reimbursing care from a preventative standpoint, um, we can't have technology intervene effectively.
Sure. Now, What do you think it takes to ensure that, all the innovations that are happening, whether it's, AI or digital innovations for healthcare, remains rooted like in real patient needs rather than just system efficiency?
Yeah, so it's interesting over time, and being on the consulting side over the last year plus, I've encountered this a lot where people have amazing ideas that will solve solutions in a silo, right? Um, and a lot of times that technology, that product gets commercialized. But what we forget to really check is how does it fit into the existing workflow, or what problem does it solve for the healthcare system? It may be a really cool idea, but at the end of the day, we have to make sure that there is a need for patients. There is some benefit, time, cost for clinicians, for patients, for health systems. And those tools have to fit in to the workflow. Everyone is spread so thin right now. And if we come up with this new technology that is so amazing, but it requires 4 extra steps to the workflow, the adoption is likely to not be there, or it's likely to experience some significant delays. So efficiency does matter, but empathy does drive adoption. So we have to have both considered when we are going out and innovating and commercializing.
Sure. So, talking about innovations and how it can improve both patient and system efficiency, what role does AI can play in helping clinicians or care teams deliver more personalized yet timely care specifically?
Yeah, so we all, everybody's talking about AI is going to replace jobs, and there's not a human connection anymore. And I understand that fear, but I think we need to shift how we view it. And AI will never replace that human connection. It will never replace empathy. It will never replace compassion.
Hmm.
But what it does is it helps solve or identify disease earlier on. So with AI, we do have the ability to, let's say, look at an EKG from a few years ago and look at a current EKG, and we are able to predict their risk for atrial fibrillation, for heart failure, for maternal cardiovascular risk. So that AI is really, I mean, we call it precision medicine. It's helping us identify the risks before they happen so we can come in and we can start treating that patient earlier on. Um, Secondly, that real time guidance allows for timely and more equitable care. So being able to have, a cardiac monitor, for example, that uses AI, um, that allows us to know what's going on with that patient in a much more timely manner than if that patient were wearing a uh, dead device that just sits there, and then they have to bring it back into the hospital and someone has to analyze it, which there's always a delay in that, or the device gets lost. And so that all of that data is now lost, and we're not able to provide that personalized or that timely care that could potentially, and I know I'm speaking like catastrophic events, but could prevent that patient from having a stroke.
Hmm. Definitely. So, talking about trends, like you must have seen like a lot of news and a lot of LinkedIn posts around what are the trends in AI and digital health. So, I just wanted to understand from your perspective, what are those trends or specifically in AI or digital health that you are more excited about when it comes to improving care and access?
This is where I get super excited. Obviously, my experience is cardiology. It's really at the core, the only thing I really know about. Um, and there, with AI and with digital health, there is so much now that we didn't know before that we are just starting to tap into. We're starting to explore adjacencies and how one disease state has to do with another. And I think this is where the innovation really is going to get exciting, where we will really start seeing some uh, really impactful products and tools to be used. So I get incredibly excited about cardio obstetrics. So being able to identify women who are at risk for preeclampsia that ultimately, could lead to maternal mortality. Also, a single event of preeclampsia puts a woman at higher risk for developing cardiovascular disease later on in life, and that is a lifetime risk. So that cardio obstetrics, the adjacency with dementia and Alzheimer's and cardiology is incredibly fascinating. And could cardiology help us identify those patients who are at risk for dementia and Alzheimer's sooner? There's a huge overlap with cardio oncology right now, cardio rheumatology. So there's a lot of really fun. There's a lot of really exciting areas that we're starting to explore now.
Definitely. And talking about, let's say, if you have to build a ideal tech-powered patient experience from scratch, what would it look like from your experience?
Well, that's a great question. So I think in an ideal world, we have EHR that is agnostic,
Mm,
and that data follows you wherever, regardless of what instance of, Epic someone is on or a different vendor, that your data is your data and it follows you. And I think the ability to integrate wearables into that is huge. And I think obviously making those wearables available to anyone. So
mm,
I think if we are, designing something that's more precision medicine, preventative, um, we have to start looking at the availability of these products, because not everyone has the ability or the availability to go buy an Apple Watch.
mm,
And so we want available wearables for everyone. And that data, as we see with, Apple Watch, with Aura, with Whoop, there's a ton of data there that can be used for risk predictions, and just wellness in general. And if we can integrate that into those EHRs to be used in a, precision medicine way, that would be amazing. Part of that also is patient education. We have um, we have a long way to go in terms of how we educate patients, by using plain language, by using multi-language models. And, physicians, and this is not a knock on physicians, they're busy. And, sometimes you go in and you only have so much time, and everyone is rushed. Patients are overwhelmed. But I think there's room for us to be able to give patients the agency to learn about their health, learn about their health, learn about their, chronic illnesses. I think we have a great opportunity to build patient education and give patients that agency, and not assume that they won't understand it. Let's
mm.
give it to them in a way that they will understand. and then they can have agency and they can be part of that shared decision making because they genuinely understand. So I think that is my, you know, unicorn solution that I would love to see. I'm sure there's no money to be made in that, but it would be very cool.
Sure. And what would be the piece of advice that you wanted to give uh, to the technologists and people who are building for healthcare nowadays, specifically in AI?
Mm. So first and foremost, build your data set on a diverse patient population. Make
Mm.
sure that there aren't bias in that AI. Make sure that it's trustworthy for everyone, and we don't have to second guess if it is as accurate on darker skin tones. So intentionally go out and make sure you are building your language models on a diverse patient set. The other thing is voice of customer, voice of customer, voice of customer. Don't just talk to a couple. Don't just talk to your friends. Talk to the naysayers. Talk to the ones who you know will disagree with you. I think that is where you really find out where some of the challenges you might encounter. And I nobody likes to hear that their product isn't viable, but it helps us build a better product. It helps us make sure that we are thinking broadly and able to adopt. And I think finally, make sure that, well, not finally, thirdly, make sure you understand the workflow. So again, a lot of these solutions we create, yes, the end user might be the physician, but who is the one deploying that? Is it the nurses? Is it the MAs? Is it, you know, the people who have to prior auth for this? Understand the workflows so
Mm.
you can deliver a scalable solution. And then, you know, again, I think build with humility, design it for everyone, just not the elite, just not the easy to reach, just not the ones who, you know, the upper 5% who can pay. Really design that with, you know, humility and compassion and intention.
Definitely. Well, thanks, Tori. It was a really great discussion, and specifically the advice part was really insightful and was really a great advice for people who are building or want to build for healthcare. So thank you so much, and looking forward to having such more conversations.
Excellent. Thank you so much for the opportunity. I appreciate it.